Value-based cost sharing is very important because it recognizes two things. It recognizes the reality that people with more money can always buy more things, including health care, than people with less money. And secondly, that we will inevitably have at least two tiers based on income. But there should not be a qualitative difference between those two tiers in terms of health outcomes. Now, obviously, what I've described doesn't even remotely resemble what we have today. And moving to that kind of system poses a huge challenge because of the huge number of economic stakeholders involved. And the list is a long list. You've got the uninsured, but all those workers who have good workplace-based coverage, seniors on Medicare. You've got employers large and small offering coverage, not offering coverage, doctors, hospitals, Jamaican faith healers, you've got the drug companies, medical device companies, the list goes on and on. So if we want to solve this politically, we've got to recognize that today millions of people's jobs depend on the current dysfunctional structure of the U.S. healthcare system. It is a fact. 1 out of every 11 jobs in our economy is in the healthcare sector. 1 out of every $7 in our economy is in the healthcare sector, and no one's going to willingly give up their job. We also need to recognize that there's a lot of trapped equity in the current system. Hospitals across America are building things, mostly cancer centers and heart centers and imaging centers because they get reimbursed really well. Doctors are investing in the same thing, freestanding ambulatory care centers. Some doctors are getting paid a lot of money to do things that are on the flat side of the population health curve, for which there's no evidence to support their efficacy, and nobody is going to simply walk away from that. So the point is, it is not only politically impossible, it's economically impossible to move from where we are today to a new system overnight. It's going to take us 8, 9, 10 years. There inevitably is going to be a transition period. Now, the practical political challenge that we face is represented by this graph that shows economic burden on the stakeholders here and time over here. If we can agree on where we want to end up, the objectives and the parameters of that new system, and if we can move from our current system to the new system, and the economic burden on all the stakeholders goes down during the transition, the politics would be easy. We would have done it a long time ago. The problem is it looks like that. To move from where we are to where we need to be, there are going to be stakeholders and institutions that are going to suffer economically during that transition period, and all of them have the ability to jam up the political process and prevent anything from happening. So to successfully put together the politics of reform, we have to shift the focus of the debate from where we want to end up to how we get there, to how we manage that transition. And what I've tried to offer you this evening, very quickly, has been the key elements necessary to actually create that kind of system that could produce the triple aim, the results that we want. So our challenge is to make the politics of this transition explicit by legitimizing and acknowledging the economics involved, and by shifting the focus of the debate from where we want to end up to how we get there, which changes the political question from how a given economic stakeholder is disadvantaged in the short term to how together we can mitigate the economic impact on all the stakeholders as we move the current system to a system that better serves the needs of our nation. But without first agreeing on where we want to end up, there is simply no political pathway by which to get there. The Roman Senator Seneca once said, "No wind is a right wind if you don't know what port you're sailing for." Now, unfortunately, there is no evidence that this vision is going to emerge from our current political process, which means it has to come from outside, from folks like you and me, and get driven back into the political process. So let me quickly run through how we might go about doing this, and we can talk about this a little bit more when we're done if you can. First, we need to remember the problem we're trying to solve. I'm sure most of you are familiar with Six Sigma, the database methodology that measures error rates in processes. A company operating Six Sigma has 3.4 errors per million. Most medicine today in America operates between 1 and 2 sigma. That is an error rate that would be absolutely unacceptable in any other business in the United States of America. So let me use heart disease to show how this plays out every day in the healthcare system. We know that lifestyle contributes as much as 80% to the development of heart disease. So right off the bat, we have a system that provides no incentives whatsoever to prevent heart disease and every incentive to treat it after it happens. Secondly, congestive heart failure is the most common hospital diagnosis for people in Medicare. But fully 40% of those people return within 90 days after they've been discharged with congestive heart failure, even though we know how to reduce that by as much as 80% by proper management. My point is this is a system problem, not a financing problem. And simply finding more money to pay for the current system is not going to get our nation where we need to be. So meeting this involves 3 key steps. The first step is the most important one, laying the foundation for reform, and that involves agreeing upon some system objectives, needing an accurate diagnosis of the problem, that is why the current system isn't meeting those objectives, and finally, a clear description of the design elements necessary to achieve those objectives. objectives. That's what I've tried to lay out for you this evening. This step has been hopped right over by most healthcare reform efforts at the state and national level today. Secondly, we need to manage the transition. We need to recognize that we can't achieve these objectives through a simple regulatory approach. We need to intentionally engage the economic market, and particularly entrepreneurial capitalism, to help design an entity, an enterprise that becomes ever more profitable by promoting wellness and prevention and reducing avoidable acute care. We also need to make the politics of the transition explicit by beginning to have a conversation about how the various stakeholders will redesign their business plans to prosper in the parameters of the new system. And finally, we need to develop on-the-ground test sites. So supposing you have a hospital with an affiliated physician group that wants to transform itself into a system that reflects those objectives and those parameters, they will immediately run into a series of statutory, regulatory, and structural obstacles that will prevent them from getting from here to there. But exposing and highlighting those obstacles gives us the ability to produce a clear comparison between the current system and the new model, and gives us the opportunity for a very clear, specific avenue for legislative redress. And we can discuss that more if you like. Okay, so let me wrap this up so I stay within my my allotted time. Albert Einstein once said that you can't solve today's problems by using the level of thinking you were having to create them. That's pretty much where we are. But I like the way the late Western novelist Edward Abbey put it, less eloquently but far more succinctly, when he said, "Society is like a stew. If you don't stir it up, you get a lot of scum." Our job, my friends, is to stir it up. Our job, it seems to me, is to accept the fact that the responsibility to fix this system, and our energy system for that matter, doesn't belong to somebody else. It's not going to happen by itself inside the Beltway. It's not going to happen in Sacramento. It's not going to happen in Salem, Oregon. It's going to happen because of the engagement and commitment of people and communities all across this nation. This is something we can do, and I think it's something we must do. And if we're not willing to do it for ourselves, we should do it for our kids and our grandkids. A gift for the future. For those people who, on our current trajectory, are going to inherit a staggering burden of debt. And this dysfunctional system that we put together on our watch, and through our inaction, we are allowing it to be perpetuated. Let me just close with the words of Oregon poet Kim Stafford, who far more eloquently than I captures, I think, the opportunity and the challenge, but also the responsibility that faces us here, and what he calls Lloyd's story. It's a true story. Lloyd Reynolds, the international citizen of Portland, spent his last days silent, unable to write or to speak, lying in a hospital bed. On his last day at home, as his wife scurried to pack his suitcase for the hospital, Lloyd made his way outside in the garden, and there she found him on his knees, awkwardly planting flower pots. "Lloyd," she said, "you'll never see those flowers." He smiled at her. "They're not for me. They're for you. Salmon coming home, they're for you. The calls of the wild geese, they're for you. The last old trees, they're for you and your children, the seventh generation. They're all blooming for you." That's our challenge. To plant the seeds of tomorrow. To change the context and the parameters and the terms of this debate. By acting and by leading and by personally committing ourselves to it, not as victims of the past, and not as captives of the status quo, but as the proud architects for the future. Thank you very much.